The following program is sponsored by the National Summit on Opioid Awareness Campaign and Walmart. This is a special edition of WYZZ News at 9.
The stigma behind drugs, that's a real thing. People think you can't change, you can't get better. I was one of those people. I thought it wasn't possible.
This is Opioids in Central Illinois, what your family needs to know.
But then I met some friends here.
And that's where we begin tonight. During the next 60 minutes, we will explore the opioid epidemic in our community, learn the depth of the problem, hear from our friends and neighbors directly impacted by it, and learn about local resources that we can turn to for help.
That's right, and following this TV special, we encourage you to join us online for a live discussion at ciproud.com or drugfreeisuptome.org, where we will also take your questions.
And the American Medical Association says more than 105,000 opioid overdose deaths reported in the United States between December of 2021 and December of 2022.
Now let's take a look at the opioid crisis locally. In all of Illinois, there were over 3,200 deadly overdoses in 2022. And also in 2022, Peoria County clocked in at 40 opioid overdose deaths.
In McLean County, in that same year, the number of opioid deaths was 17.
WYZZ sat down with local leaders, medical professionals, and people who have dedicated their livelihoods to this problem.
The consensus is that the opioid epidemic is here in Central Illinois.
It's not just a local Peoria problem or a Central Illinois problem or even a state of Illinois. I mean, it really is a national problem and has been for the last several years now.
Probably at least a fifth of the people, the 300 people that are in custody at the jail, they've had some type of addiction at least.
Oxycontin, fentanyl, so those are the most common ones that I've seen.
Often what we see here in Peoria County related to drug-related deaths and substance use is fentanyl and heroin.
It's a thing around here every day, and we want to get our community past this. We have enough challenges in our community without having people dying in such a senseless way.
It is an issue that impacts not only our local residents, but their families and communities around them.
So what exactly are opioids? There are two different kinds, an opiate and an opioid. One of them is synthetic manifestation of opioids. The other is the more natural plant-based poppy opium. We sat down with doctors from Carl and OSF who explain how both kinds react with the brain.
Opioids are basically just a drug, a substance that acts on the opioid receptors in the brain.
We used to call them narcotics. So there are pharmaceutical grade, we've probably heard of them, Vicodin, hydrocodone, oxycodone, morphine, but then there are also illegal ones. We talk about heroin, which is actually made out of morphine that are made and sold on the street. And then we have fentanyl, which is a big issue these days.
They come in various forms. Typically we see them as pills. Sometimes you can see them as patches, or when you're in the hospital given as something through the IV.
They work within the brain to decrease the pain sensations, but they also work on the pleasure center of the brain to provide relaxation, euphoria, kind of a calmness per se. They're great pain medications, but the problem is the longer you use opioids, the more likely you're to build a tolerance.
So why do people keep using opioids if they are bad for you? There's a variety of ways people get into these drugs, some as simple as getting prescribed them. But opioids are unique. Most people cannot just quit cold turkey. Usually, medical intervention is needed. But first, the community needs to understand that addiction is a disease and users aren't bad people.
Addiction is a disease like any other disease, like high blood pressure and diabetes, and so it can be very challenging for patients to overcome.
The addiction is very, very powerful. It's not a want, it's an absolute need. And so it's overpowering this sense that they have to have it.
Addiction kind of felt like I was never able to, I was a slave, really. I mean, essentially, I wasn't able to go places for long periods of time without having the drugs.
The brain makes opiates naturally, so they're indigenous to our body. So when we take an opioid, it feels like it belongs in the brain already. There is no resistance.
It's an uncontrollable feeling, and it's very unpredictable on how much of that drug the body can actually absorb and take, and it creates an overdose.
We don't, if someone has diabetes or high blood pressure, we don't go, oh my gosh, they have diabetes, oh, they choose to have diabetes. When we get into the substance abuse field, we frequently think that someone makes a choice to have the lifestyle, or if they just made better choices, they wouldn't have it. Well, substance abuse is an illness just like a diabetes, and at some point in time, medical care is going to be part of dealing with that.
I think the general population actually believes that people set out in their life to become substance users. That each one of these people, when you look into their eyes, don't have a story to tell, and they do.
Nobody that I know that is addicted to drugs is like, I hope this one kills me. Nobody's looking to die out here. They're just looking to try to not be sick.
While many are struggling with substance abuse, the goal for many right now is just to stay alive.
And coming up, we'll show you how you can help as a bystander and what exactly is Narcan and how it can save someone's life.
You're watching a special edition of WYZZ News at 9, Opioids in Central Illinois.
Our goal is to get that person breathing again, because what a narcotic does to you is it depresses your respiratory system until you eventually stop breathing. And so we give Narcan to get somebody breathing again.
Federal health officials blame the steep increase in opioid overdose deaths in part to the rapid growth of highly potent and often deadly fentanyl that can be added to look-alike opioid drugs.
And the Surgeon General recommends more individuals, including family, friends, and those personally at risk for opioid overdose, keep on hand and know how to use naloxone, a safe antidote to a suspected overdose. When given in time, naloxone can save a life.
And you may know it also as a nasal spray that's called Narcan. So what exactly is Narcan?
Narcan is one of the antidotes we use for opioid overdoses. It works by essentially binding to the spots that opioids bind to in the body and reversing their effects.
It blocks those receptors so the opioids can't have that effect anymore and reverses that respiratory suppression and can truly save lives, sometimes requiring more than one dose, depending on how much opioid has been used or the strength of that opioid.
Ultimately, if they don't get it and they don't have enough of the narcotic in their body, some of them come around, and then unfortunately, a lot of them don't.
You might be wondering who administers Narcan in the area.
All of our deputies carry Narcan. They have for the last 5 years. We use it approximately about 30 times a year. Countywide, I think they're using it about 700 times a year between the emergency department, AMT, firefighters, and then police. It's averaging about 700 times a year.
Our police officers carry Narcan. All fire stations have Narcan. We have them in the fire stations on all the fire apparatus. All of our medical bags have Narcan in them.
Our most typical route of administration is through a shot or an IV.
We encourage everybody to have it. We encourage, obviously, the police have it, the firemen have it, the paramedics have it. We encourage family members to have it.
If you suspect that someone is overdosing, paramedics say the first thing to do is call 911. While the paramedics and firefighters get there as fast as they can, sometimes someone else needs to step in. Giving someone Narcan as a nasal spray can save someone's life until they get to the hospital. Advanced Medical Transport in Peoria shows us how you can administer Narcan.
The kits that are provided to the public are intranasal typically. So they go through an atomized mist up through a person's nasal passages and get absorbed through mucous membranes.
Narcan can be purchased over the counter. Many places give it out for free for the community, and they can administer Narcan themselves. I don't have to have a prescription or a doctor's note or anything like that to be able to administer it.
So calling 911 first is great, and then just following the instructions, and they're really simple. It's actually easier for a bystander to administer. And The directions are very simple. They're printed on the box. Even if you don't have that, it's very easy to figure it out. You take the cap off, and as long as you get it in the proper place where it can reach the mucous membranes and the nasal passages, it actually works very quickly.
When we respond to somebody with a suspected opioid overdose, we always assess their level of consciousness, if they're awake or not awake, and then look for other signs that they may possibly have an opioid on board. Things like suppressed respiratory drive, as well as pinpoint pupils are large indicators that somebody has an opioid overdose. So we will administer Narcan in a mist up through their nose, and it will help restore their respiratory drive.
So now you know how important it is to have Narcan, as well as how to administer it. But where can you get it from? You can buy it over the counter, but there are also many resources in Central Illinois that give Narcan and fentanyl test strips out for free. Some organizations like Jolt Harm Reduction on Sheridan in Peoria have them available at their location. But as you will see, there are vending machines and boxes all over.
You have Narcan here?
I do, yes.
And anyone can just come.
Anyone can come get it. And we have a vending machine that has Narcan and the intramuscular injectable naloxone. The health department and Carl Health has also got a couple of boxes around the city. We're looking at more. We have one in the East Bluff right now by the East Bluff Community Center that's just kind of embedded in that community. Our partner, Sue Tisdale, who works over at Carl Health at Trillium Place, she really focused a lot on equipping organizations and community members and community organizations with Narcan.
I train and actually distribute nasal naloxone. And the grants that I work under, a drug overdose prevention program grant and an overdose education and naloxone distribution grant that covers 40 counties. I cover 15 of those counties. So basically, I can train anyone, any group, any organization, and then equip them with nasal naloxone absolutely free. We have currently 3 vending machines in Central Illinois. We have one located in Peoria downtown at CityLink Bus Terminal. It's accessible, I think it's from 6 a.m. till 10 p.m. at night. And it has basically nasal naloxone in it and fentanyl and xylazine test strips. A regular snack machine, you go up, select what product you may want. For instance, maybe F3, push the coinciding letter and number, and it will disperse for free the product that you choose.
Along with the vending machines, some community members all over the area are working to get Narcan right into the community. It's all to prevent opioid overdose deaths. Jolt Harm Reduction goes out into the community and even into trap houses. The Peoria Fire Department makes sure people who need Narcan get it. And Chestnut Health Services in McLean County also has resources.
We are the McLean County drug overdose prevention provider, so we provide naloxone, or brand name Narcan, to community organizations, agencies, and individuals, and we offer trainings as well. So that is an impactful way for anyone that is interested to access Narcan or have it in their possession.
We have our Narcan Leave Behind program, so we get a lot of people who are they're repeated users, and we go to the same addresses, we go to the same people. So we have a Narcan Leave Behind program. So if in the event that we have someone who has a drug overdose, we'll leave a Narcan back for them, for the family.
I think we're able to do things that other organizations can't do. We'll go into abandoned buildings, we'll go into trap houses, we will talk with drug dealers. I have drug dealers that pass out Narcan when they sell stuff to their clients. When I say, oh, we give Narcan to drug dealers, people are gonna lose their mind like we're still contributing to the problem somehow. But when you think about where people are at greatest risk and who's that point of contact, it's the dealer.
And I think public access is important because many times when we get to a scene, there's nobody around where there had been somebody around, particularly the person that called 911, but people don't want to get in trouble, so they vacate the scene. But if they have access to Narcan, they can help begin to turn that person around before we get there.
You may be wondering, can I get in trouble for administering Narcan or helping someone who is overdosing?
That's a good question to wonder. We break down the laws that protect you coming up.
You're watching a special edition of WYZZ News at 9, Opioids in Central Illinois.
So you see someone you think is overdosing. You call 911, you give them Narcan.
But can you get in trouble even if you may have drugs on you? WYZZ sat down with the Peoria County State's attorney to find out.
We do have a Good Samaritan law in Illinois. What that law says is if somebody is experiencing an overdose and somebody calls for the paramedics, calls 911, or calls for the police to help that person, then they cannot be prosecuted for possessing drugs. They can be prosecuted if they delivered the drugs or if they happen to be the drug dealer. The goal of that was to save lives, obviously.
The Peoria County Sheriff's Office and State's Attorney have similar goals.
That's right. While they have to abide by the laws, they want to help those suffering from substance abuse but are less kind towards drug dealers.
They're arrested if they're caught selling it. Possession, most time they're also arrested too, because it's still a felony to hold a drug that's not prescribed to you. Most time these overdose calls, there's not a criminal offense attached to them. So we go, make sure there's nothing we can do medically. As soon as first responders show up and take them to the hospital, we're usually done. If they're going to the hospital, most of the time we're collecting it and putting it in evidence and just forwarding it to the state's attorney. If she wants to file charges, she can.
Yeah, so my office, we have a two-track approach. Our emphasis, if you're a drug addict, our emphasis is prevention. We want to get you back on your feet, make you a productive member of society. If you are a drug dealer, then we're going to prosecute you. My office has zero tolerance for drug dealers. We want to remove you from the street, and we want to remove the drugs from the street as well. When it comes to the addicts and the prevention side of things, we have specialty courts in place. We have 4 of them, a DUI court, a drug court, a mental health court, and a veterans court. All of those are designed to get addicts the help they need. They can get treatment as long as they successfully complete everything they're supposed to do within that court time period, then their case, it's a better disposition for them of their case.
So where are all these drugs coming from?
We'll tell you how some people get addicted after the break.
You're watching a special edition of WYZZ News at 9, Opioids in Central Illinois.
In 2022, the Drug Enforcement Administration seized over 12 million deadly doses of fentanyl in Illinois.
So where is this fentanyl coming from? How are people getting access to opioids? And how do people get addicted in the first place?
It's a mixture of many factors, including drug cartels and overprescribing. Some people even get it from their own family.
Go back in time when I first became a nurse back in the late 90s and the 2000s, and I was working in an emergency department here in Peoria, and it would be nothing for us to prescribe 40 to 60 tablets of a narcotic to go home with an ankle sprain or a wrist sprain or a dental infection or something like that. And so we've created a problem, and now nobody wants to try to fix it.
Let's look at athletic injuries. Major pain. Well, this is what the doctor prescribed, not thinking that maybe along the way I might be hooked on this. So they start taking it.
One part of it is the prescription, but like I said, that's getting controlled a lot better these days. So we're not seeing that as a big issue like it used to be. Still an issue of taking too many pain pills where it causes an overdose, but now you have fentanyl. Now the meth is coming from Mexico. But what the drug dealers and cartels have figured out, if you mix a little bit of fentanyl in that meth, it makes it a lot more potent, it's cheaper, and people will buy it.
It can start many different ways. I mean, it can start illicitly with illicit substances that just continue to escalate and open the door for other substances. It can start as innocently as a pain medication for an injury. There's lots of ways to do it. The other part of that is they're starting to put fentanyl in other substances.
There's a lot more fentanyl coming into that. So, and it's cheap. So if you're unemployed and you're just trying to get through the day, that's an option that they're doing, and unfortunately that's where our overdoses are coming from a lot.
And as far as leading causes, there's a number of factors that can fuel this. One of the biggest ones is people struggling with their mental health. So using it as a coping strategy to get through some sort of psychological pain or distress, something going on in their life.
It started with family, you know, encouraging me to do it, and oh, it's cool, you know, and I didn't have a lot of friends as a kid growing up. So when one of my cousins was like, you can try this, it takes away your pain.
No matter how someone got into opioids, we as a community need to start fixing the problem.
And we will explore solutions and treatment options coming up next.
You're watching a special edition of WYZZ News at 9, Opioids in Central Illinois.
So now that we know the opioid epidemic problem is in Illinois, what are some solutions?
Doctors and lawmakers are working to curb overprescribing.
Narcotic pain medications are for acute use only. Any prescriber who prescribes a greater quantity of medications for an acute pain is really perpetuating the problem.
Due to the concerns for opioid addiction, providers now are trying to limit the amount of opioids that we prescribe.
We've passed legislation that insists that pharmacies, alert their patients if they have drugs that have, opioids or any addictive materials in there.
And Dr. Robert Leiser, an addiction medicine physician at Carle Health, says if you do get prescribed pain medications, do not take it for more than 5 days. He says around 7 days is when you start developing a dependence.
Some, like the Peoria County Sheriff, are also calling to fix the border crisis to help reduce the flow of fentanyl into our communities. There is also opioid litigation against big pharmaceutical companies that could bring money towards harm reduction and prevention.
Now there are also subsequent lawsuits against the Walgreens and the CVS's and things like that for overflowing the streets with opioids. We have recovered over $500,000 to date this past year as a result of the settlements in that lawsuit, and those funds will all go towards prevention and helping the addicts and those people that really need it.
I think that there's now a lot of pressure on the industry because of the lawsuits to make sure that if a doctor prescribes it, that the patient really needs it.
So what if you've already been prescribed a kind of opioid? How can you stay safe while also keeping your loved ones safe?
So short quantity, if you have any pills left over, you need to discard them in the appropriate places. There's drop boxes all over the place. If you can't get to one soon, you need to keep your drugs locked up because people will come to your house who have a substance use issue and they will go through your medicine cabinets, your dresser drawers, wherever they can to find pills, and they'll steal them.
One state representative is working with the Peoria County Sheriff as well as a Pekin Rehabilitation Center to give addicts a place to sit until they can get into a treatment program.
So what I'm working on with the sheriff and with Teen Challenge is a mechanism where the sheriff would hold them in jail for a 48-hour to 72-hour type period. And the reason just being, it's a place where they can be held, contained, and wait for a Teen Challenge to arrive. Then they come, they sit with them and say, hey, here's your options. Do you want to come have a new lease on life and come get your life back on track? And they may say no, but they may say yes. But then we're also going to have to rethink what our laws look like. Currently, you can't hold somebody in jail without charging them with something. That's what we would be doing. It would be as a service to the addict, but you're still holding them without charging them with anything.
Yeah, so finding a place to get them a safe place, to get them away from the substance, to be able to get services in front of them and opportunity for them to make a change.
That's one thing about jail. Sometimes that gives people the time out. Where we have resources in jail if you're in withdrawal. So say you're addicted to fentanyl, heroin, you come and get arrested. We have those resources here at the jail to give you on the right path. But once you get released, we'll also guide you in the path you need to go, but you gotta want to, or you'll end up, unfortunately, you're gonna end up back here, you're gonna end up dead.
There are resources at the Peoria County Jail to help those that want to seek treatment.
If you're a dealer, you know the state's attorney's going to try to hold them accountable and keep them in jail. If they're a user, you know there's drug court, there's drug treatment court. That's where our case manager, Angel Cruz, comes in play.
Angel Cruz is the case manager at the jail. He works with people he sees that go behind bars again and again for drug-related crimes. He has personal experience to connect those suffering with addiction to the exact resources that they need.
I'm a recovering heroin addict, 25 years sober. Mine was that in the home, in my home where I was raised, it was the controlling influence. So there's many aspects of when we look at what is an opiate or how does one get addicted, right? I deal with a population of men and women who come in here after an overdose or their criminal history is based on their opioid addiction. How do we deal with that? First and foremost, my role, yes, I'm a reentry case manager, but to really find out the core of the person's issue and why they've been doing this so long, why their criminal history is based on their opioid addiction, is establishing a relationship of trust to say, hey, when do we draw the line? I'm so grateful to the sheriff and the Peoria County in general for allowing me to really come in here and try my best to say, hey, there's resources. You know, there's no more excuse. They're out there. I'm your advocate, and I'll advocate. I can only go as far as you allow me to go so that we can hit this goal together.
So what are some of the resources available in Central Illinois?
We break down some places that can help you or a loved one with an opioid addiction.
You're watching a special edition of WYZZ News at 9, Opioids in Central Illinois.
Doing it on your own never works. You gotta have a recovery plan. I always say you need support and accountability.
There are many resources available in Central Illinois to get you or a loved one the treatment needed.
An opioid addiction is a hard one to overcome. We spoke with 3 places in Central Illinois that can get you on the right track.
Let's begin with Jolt Harm Reduction in Peoria. That started in 2012 after the deadly overdose of Joshua Old. Now, we've already talked about how they give out Narcan. They also work to get fentanyl test strips into the community, among many other services.
To tell somebody who's dope sick, like severely dope sick, to not use drugs is ludicrous. It's just not going to happen. But what we find is when people are aware of what's in the substance they're consuming, they alter their pattern of behavior in consuming it to make it safer. So we work with people. So Jolt itself, we work with people from chaotic street drug use through managed and moderated use to medication-assisted recovery like Suboxone or methadone into complete abstinence. And then we help them navigate treatment processes. So anybody can call us and say, hey, I'm interested in getting into treatment. And we'll say, great, we're going to hook you up with one of our peer navigators. So these are people with lived experience who have sustained recovery that can then walk them through the process of seeking out whatever resources they need. We work with the OSF street medicine team. Dr. Mary Staple just started prescribing Suboxone on the mobile unit. So yeah, it's all free to anybody who needs it.
Suboxone can be prescribed by a medical professional to treat opioid use disorder. Along with Narcan and fentanyl test strips, Jolt has a Sharps container out front of their building on Sheridan Road that is open 24/7.
And in Pekin, Adult and Teen Challenge is a more faith-based place to get help. There's also a women's facility in Carlinville. They acknowledge that getting help as a woman can be more difficult, especially when children are involved.
Adult and Teen Challenge, we have our Adult Male Center here in Pekin, Illinois, which is a 40-bed facility. We charge $1,200, one-time fee for the whole year. So this 1 year, and here at Teen Challenge, we're able to really approach them on a holistic level. So we're not only addressing the addiction and the root causes of the addiction and trauma in their lives, but with our work programs, we're also giving them work ethic, real-world job skills that they're going to come into play when they graduate. We are 100% faith-based. Not any one treatment works for everybody. As a collective, we need all the various different types of treatment to really address this issue. We have our Adult Women's Center down in Carlinville, Illinois, and that is a 26-bed facility.
Most women have children. To be separated from the kid is really hard, so women don't come in as quick as the men do. For one of the things that we want to do here is we want restoration without separation for the children and the mom, a place where the mother and the child can come to and get restored back and get healthy and be able to be productive again.
Joe says that only about 30% of people actually can pay that $1,200 a year fee, but that doesn't stop users from being welcomed.
And over in McLean County, there's Chestnut Health Systems that can help you navigate through addiction. They also work closely with Carl Broman Medical Center.
Chestnut Health Systems served about 2,800 people last year for substance abuse issues. Within that, about 2,200 said some form of opioid use.
We have services at Chestnut Health Systems, anything from inpatient all the way through outpatient services.
I think that from my perspective is that Chestnut is frequently seen only as a substance abuse treatment provider or a behavioral health provider, not forget that medical side of the equation. So seeing a primary care doc to deal with substance abuse is just as important as the behavioral health side. So anyone looking for care should be kind of balancing both sides of that treatment.
So we have a good relationship with Chestnut Health Systems. We work closely with them with their patients that need detoxification. It can be a direct admit so you don't have any chance of going off using substances again.
We are a not-for-profit, so we are dedicated to the idea of serving the under care, those who receive less care. We actually have an entire infrastructure in place to deal with individuals who have no ability to have coverage whatsoever. So the phone number here from a starting point is 309-827-6026, and that'll get you right to the front desk.
These are just a few of the resources and treatment facilities in our area. Carl Health has an access center.
Carl also offers Trillium Place that has mental health and substance use services. All you have to do is call.
And so you may suspect that someone is using. How to have that difficult conversation to help them get the care that they need.
Hear from experts after the break.
You're watching a special edition of WYZZ News at 9, Opioids in Central Illinois.
So there are resources out there to help overcome an opioid addiction, but it may be difficult to get someone to realize that they need help. Local experts share how you might navigate having that difficult conversation.
I think just listening to the individual and setting a time limit on how long to actually have that conversation for, I think is a very big part about it.
If we can come in a non-accusatory way, if we can more share concern and say, you know, hey, I've noticed that you seem to be struggling, or this seems to be a struggle. Is there a way that I can help you with that I can help you find resources? And I think taking that approach of care and love and concern will get a lot further than any kind of, accusation.
And how do you have that difficult conversation about opioids to your kids? A professional like Carl Broman offers some advice.
Start young. Don't wait till a kid get into high school or junior high thinking that's when we need to have that conversation about medication in general. So as soon as kids can understand medication at all, you start having conversations about medication. You talk about the proper way to use medication. You talk about how it can be harmful if you use them wrong. And you talk about illegal drugs so that the kids will already have that information. Another thing is don't use scare tactics when you're talking to kids. Don't lecture. That's not good. Give them reliable information and truthful information, because if a kid finds out that what we've shared with them is not accurate, they will stop trusting us as parents. Plan to have multiple conversations. So it's not a one and done conversation, but it's as they grow, you continue to have conversations to their maturity level. And this conversation should not be long and drawn out. It should just, be right to the point.
How do you know if a teenager is using? There are some signs and behaviors that parents, friends, and teachers should look out for.
When it comes to opioids specifically, so looking for signs of misuse, so nausea, shallow breathing, poor coordination, drowsiness, confusion are all signs that someone could be misusing opioids. And then looking for other cues like medications that are missing, lost or misplaced, excessive mood swings or hostility can also be factors, decline in athletic performance or academic performance, changing out friend groups, changes in extracurricular activities.
What resources are out there to help teach your kids about opioids? Through different organizations and laws, they could learn about drug safety in school.
Right now, what I'm doing in schools has nothing to do with younger individuals, with the students. It's actually about the staff that are being trained and equipped with nasal naloxone. Illinois just passed a bill, HB 3428, that takes effect January 1st, that all schools in Illinois need to be equipped with the opioid antagonist naloxone.
We have a Stay Sharp program where we go into the schools and into the community and are able to talk to the children about the opiates use and what it does to them. And we don't do the scare straight tactic, but we do let them know if they have friends that are using it to also speak up for their friends to get their friends some help.
Mostly Holt Center works with prevention and educating youth. For education specific to opioids and prescription medication safety, we do have a contract with Peoria Public Schools where we provide programs to 4th, 8th, and 9th grade that do address prescription medication safety.
Still to come, hear the personal journeys of people who have gone through an opioid addiction and live to tell their tale.
You're watching a special edition of WYZZ News at 9, Opioids in Central Illinois.
WYZZ sat down with 2 young men to share their experiences. Now, these are stories of hope, people who have turned their life around and now spend their lives helping others.
At Pekin Adult and Teen Challenge, Logan is program facilitator. He is a mentor to others and has overcome many hardships himself.
I remember when I was about 14, 15 years old, some of my friends would tell me that they had opiate prescription painkillers, and that's how it really started. I really didn't understand what I was even taking. I was kind of just doing it to feel good. I actually discovered a girlfriend at the time. I discovered her body overdosed. I've lost 9 friends to overdose. I've overdosed twice myself, and shouldn't be standing here today, but through Narcan. I was Narcan twice and brought back from the overdose. So I had many opportunities before to accept the help on my own free will, but unfortunately it took till incarceration to kind of bring me to my wit's end and realized that I needed to change the lifestyle I was living. Coming into Teen Challenge, I was a broken man with a broken family, no hope for the future. In the beginning, life was a little rough, but they gave me a place of peace and taught me discipline.
And Doug used to be homeless with his wife.
But now he is working with jolt harm reduction and using his experiences to make a difference in other people's lives.
Yeah, I've overdosed one time. So I was out flying a sign and a man pulled up and gave me a $5 bill, and he's like, "There's something in there." I put the needle in my arm, and that was it. Lights out. Next thing I know, I'm waking up in an ambulance with police surrounding me, and they Narcan me. I then tried to fight my way out of the ambulance and ended up going to jail, which probably was for the best because it gave me a chance to sit back and think. I got out, and you would think, I did 3 months, 90 days. You would think you would just be like, okay, I don't want to do that crap no more. And it was definitely not that's not the case. I didn't know how to handle life being homeless. There really wasn't a breaking point until the police got involved. And I was like, oh, I'm gonna go sit in jail again. Let me just opt out and try to go to treatment. So it was like December of 2022. Me and her started talking about going to treatment. Now I know how to help people because I not only do I have lived experience out in the streets, but I know how people like that need to be talked to, with dignity, respect. Yeah, if you're struggling, come to Jolt and see me.
These 2 young adults made it through and now help others get through one of the hardest times of their lives.
Addiction is hard, withdrawal is hard, but you are not alone. If you are suffering, reach out to any of these resources.
The Central Illinois community wants to help. To continue the conversation, head online to ciproud.com right now to ask experts in real time anything about opioids. We hope to see you there.